Professor Piga, tell us a little bit about the importance of the regular iron monitoring and also the early detection of iron overload. How does this influence the patient outcomes?
Oh, a lot. It's key because in transfusion-dependent patient, a good monitor and treatment, it's life-saving because we explained very early to the patient, listen, iron toxicity is slow, yes, but it's also silent. You don't feel signs, symptoms, and is on long term a silent killer. So we now know early that you have a clinically significant iron overload. Let's treat and keep this iron overload very low, close to the normal levels ideally. So you may give to the patient a normal life path, and you may prevent most, if not all, the iron-related complications that are so important in thalassemia syndromes. For thalassemia intermedia, that is thalassemia that do not require a transfusion regularly, to check at least once and early possibly the MRI, it's very important because serum ferritin in thalassemia intermedia tends to be lower than the level of liver iron concentration. So it's possible to have easily to have an underestimation. Let's say to have a patient where the serum ferritin is floating between 200 and 1000 and saying, okay, it's not normal, but it's not so high, is not enough. You must check by MRI because in a consistent part of the patient, you may find an important liver iron concentration, so the need to start iron chelation. And in a minority of patients, you may find, but just a minority, you may find also some cardiac iron load.
Okay, so I think everybody is now convinced that monitoring iron load using a reliable method, which is actually the MRI method, is key for guiding the chelation strategy, for checking the compliance of patients with the chelation regime, and also for, of course, for preventing iron overload complications. But what are the Professor Porter, what are the main challenges that healthcare professionals face in implementing MRI assessments in the different healthcare settings?
The main challenge in the UK is getting someone to set it up and validate it. Even though we have quite sophisticated MRI units in most of our hospitals, it is actually quite difficult arranging to get things done in a systematic way. Some people assume it's very easy and then don't do the appropriate checks. Others have difficulty in doing the appropriate checks beforehand. So you need somebody who's going to take an interest to help set it up. It's actually not that difficult, but it needs to be done properly. A lot depends on which method you're going to use. Again, I would favor a method which has been externally validated rather than trying to set up a method in your own hospital. Some people have tried to do this in the UK, and I worry about it a little bit. So you need a method which has an external validation. Otherwise, you have to think about using phantoms to calibrate the signal you're getting on each machine, and that is potentially problematic. So that's one set of issues. Another thing to talk about, which I don't know if you're planning to do that, is to ask the question, well, we now have ways of treating iron overload in the liver. We have ways of monitoring the iron overload in the liver, but is that enough? People are increasingly interested or concerned to look at fibrosis in the liver. Now, traditionally, we would do a look at that with biopsy, but this is not a popular thing to do, except for people coming up for transplantation or gene therapy. I think the doctors there are less inhibited about sticking needles in people. But with that notwithstanding, it is actually important sometimes to know whether there is advancing or early cirrhosis and so on. And the methodology we have at the moment isn't perfect. The FibroScan method is quite a simple elastomeric, it looks at the elasticity of the liver, which is a useful thing to do. It also is influenced by fat in the liver. So none of these things are complicated, are straightforward, and they are quite complicated. So even the MRI, which is very important, doesn't stand alone in the overall spectrum of liver disease from iron overload.
Okay, so an important challenge is always the external validation of the method that we're using, because otherwise we don't know what we actually measure, and this will lead to clinical misjudgment and also to waste of money and so on. But what about access to an MRI machine, to an MRI scan in general, particularly in low-resource countries? Because before worrying about validation, we need to somehow ensure that there is an MRI scanner to which the patient may have access.
So most small, even medium-sized hospitals have access to MRI machines. So although some won't, in general, MRI machines will be available. Getting time on those can be challenging, particularly if it's a very busy, overstretched unit, and persuading the other clinicians in that hospital unit that they should make space for the thalassemia patients sometimes can be difficult. So it's not just a technical issue, it's an organizational resource issue.
How much time does an MRI scan for iron assessment take?
So that depends to some extent on the methodology you're using, but you can be all done, including getting on the bed and having the assessment and getting off in 15 minutes. And with the new methodology, with the Ferry Smart, that's even faster. So time is not really the issue.
Because finding enough slots in the schedule of a very busy MRI laboratory is also another important challenge, as you mentioned, but this is a very quick method. So usually an MRI scan may take up to 45 minutes, but this is a very quick method of almost 15 minutes and you're done. So Professor Piga, given these challenges, and what are the strategies or solutions that can be adopted to overcome them? And I want you to focus more on the low-resource countries where actually most of the thalassemia patients live.
Yes, this is the problem. And recently, TIF had a survey, very large survey, and having a result that speaks very clearly that is in median countries or high resources countries, there are many MRI systems, maybe more than needed in some cases. But in many countries where thalassemia is very important, the number is very low, and in some countries is zero. So what to do? or to lobby, that is to put together for us that are healthcare providers, not to be passive, to say, okay, I don't have a service, I don't have an MRI system, I cannot do, full stop. But if the number of patients is enough, to try to lobby in a positive and virtuous way, that is to try to find forces with the association for thalassemia, in example, and also joining with other diseases, because MRI and the iron assessment by MRI is important for many other diseases too. So joining the efforts, it may be possible to lobby to have a single MRI if it doesn't exist. And doing that is important to ask for the new MRI, of if a new MRI is going to be bought by an hospital, to ask to be sure that that MRI has the iron software, let's say so-called, that is today relatively easy for any company, let's say GE, Siemens, Philips, all of them do have dedicated software for the iron assessment. And it's very easy and cheap, or it costs nothing with the new system. If there is not a new system and the software is missing, it may cost a lot to ask to add the software for iron to an old or relatively old machine. And then, if possible, as Professor Porter was saying, to have at least once a comparison with an independent machine, to have some validation of the system. That may be very important. The only one that doesn't need this is FeriSmart, that is the new version of FeriScan, let's say. So T2 approach, the most validated one, approved also by FDA and other entities, national entities. But the limit is no heart with this, and the other limit is that is relatively expensive. So I guess that an effort to try to have the FeriSmart at a relatively low price, an acceptable price, let's say just a number, just to say something different from the present cost, to go down to something like $50, $40 euros, may be a good approach to have also this system.